Hello and welcome to day 2 of the National Press Foundation America's Long-Term Care Crisis Journalism Training. We are here today to follow up on a really solid day yesterday of high-level policy discussions, conversations around healthcare, workforce, and infrastructure, and whether states or the federal government need to be doing more about supporting families in long-term caregiving. Today, I think I'd like us to pivot a bit more towards storytelling, because as we've learned in talking with all the people who've visited with us, what's really at the core of this issue is hearing the voices of families and what they're going through, and really honoring them, and coming up with common sense policies and services that really address their needs. So this morning's first session is actually going to get us started on that theme I promised yesterday, which is equity in providing and access to long-term care supports and services. We're joined today by two people who are going to take us on that journey, a storytelling journey, by talking about not only personal experiences, but about the need for journalists to truly understand the broader context of this issue. In other words, it may seem that money solves everything, but one thing we know for sure is that people in low resource communities truly need access to long-term care supports and services. So we're joined today by Rita Choula. Rita is the Director of Caregiving at AARP, and also by Joon. Joon is the CEO of Iona Senior Services. And of course, we know that we'll be taking our field trip this afternoon to Iona. So we are grateful for him for doing sort of double duty in setting us up for the trip, but also really giving us a good grounding in this issue. So welcome to both of you, and thank you for coming.
Thank you.
Thank you.
So I wanted to start with you, Rita, because not only are you someone who deals with this issue day to day in your job, but I learned that you accessed Iona Senior Services during a time when you were dealing with your mother's caregiving crisis. So let me ask you to start by telling us a little bit more about what you do at AARP, and then bring us into your mom's journey.
Sure. Thank you, Rachel. And I have to say thanks to you, to Kim Sedmak, and the whole team for bringing all of these journalists together. As you said when you opened, the importance of telling stories. We talk to caregivers and older adults all the time who say they feel invisible. And so to be able to see themselves and whatever stories are told in whatever ways is just really critical. So really appreciate that. I've been here at AARP for 16 years now. I'm the Senior Director of Caregiving in the AARP Public Policy Institute, and focus very much on the caregiving journey and really building bridges from policy and research to practice. So again, ensuring that we're not working in silos, and that the research and the policies that are put forth for family caregivers are really inclusive of their needs. And specifically, I look at racial and ethnic differences in family caregiving experiences, as well as generational. Again, recognizing that family caregivers, for every one that you see, you've seen exactly that one caregiver. And I have the opportunity to work across teams throughout the organization and externally to really help build policies and programs to better support their needs.
And so bring us to where you found yourself in the position of needing.
Yes, so my work and my life have married each other really closely for a long time. And I can't tell if I'm exhausted from it or motivated from it. I think it's really driven me to be so passionate about this issue. I cared for my mom who lived with frontotemporal dementia for 15 years. 9 of those years, I was was also a sandwich generation caregiver. My two children were born into a caregiving situation with their grandmother. And so I found myself not only navigating services and trying to figure out elder care for someone with a dementia that is not as well known as Alzheimer's or other dementias, and really trying to figure out how to navigate her care and ensure that she received care with dignity, as well as caring for two children. Quite honestly, I was looking for elder care at the same time that I was looking for daycare. And
Let me stop you right there, because what I think we benefited so much on Sunday by hearing from Sandeep Jauhar, but he helped us really feel like we got to know who his father was. So start by telling us about your mom, who she was, and your family.
Sure, thank you for that. And so my mom, we are actually in 2 weeks coming up on the 3rd year of her passing, but she lived such a full life.
What was her name?
Theresa Bryant was her name. And it's interesting being in this room because my mom actually got her undergrad in journalism and was very committed to telling the story. I come from a family of journalists, and she was so very proud to be able to be in that position wherever she was. My mom loved volunteering. She was a card-carrying union member. She is who taught me about social justice and ensuring that if there's an issue, if there are individuals that have needs, and that you're in a position to be able to support them and help them, that you better get out there and fight for them. She loved her grandchildren. Even in the full throes of dementia, she made sure that she was there to support them and care for them. When she was we placed her in a nursing home, you might imagine many different things, but let me tell you that Grandma Theresa had a drawer full of snacks so that when they came in there were cookies and chips and everything that they needed from their grandmother. And so, she was a fighter all the way to the end. And, it was really about how does she take care of others? And that really drove me to making sure that she had the best care and she had the best things that would help support her. So thank you for asking about her.
Well, I'm going to keep digging because, one, you've got a room full of journalists, so where did she go to journalism school, and where did she work? Did she work as a journalist?
So she went to St. Mary of the Woods in Indiana, Terre Haute, Indiana. And actually, she did not end up becoming a journalist. My grandfather, Simeon Booker, was with Johnson Publishing Company for many, many years.
I think they call that burying the lead. Simeon Booker was your grandfather?
Yes, he was.
Okay, why didn't I know that?
I don't know. We never had that conversation. Okay. Yes, so he she wanted to kind of follow in his footsteps, which was, as you might imagine, big footsteps to follow in, and ended up not doing that. She actually ended up working for what is now known as Verizon, and working in the communications field. But she was always finding the story, whether it was the grocery store, whether it was at church, wherever that might be, she was finding the story.
So before we go to Joon, I think the pivotal part in this story, before we come back to you, is when did you first start to notice something was wrong?
It was actually my grandmother had started to get ill. We were caring for her as well. And my mom had unfortunately been struck by a hit-and-run driver, and had a traumatic brain injury from a concussion. We didn't recognize it. Science has come far now, but at the time, traumatic brain injuries, depending on where they were, she fell on the front of her head. And so it was in her frontotemporal area. And that fun-loving person that I'm telling you all about went away. It wasn't about memory. Frontotemporal is not about that, but it's about behaviors. She was agitated. She was not able to take care of her finances. She did not laugh. My mom was a huge laugher. Her empathy, or should I say, her empathy went away and she became extremely apathetic. And we just knew that something was wrong. But unfortunately, as you may know, that with frontotemporal dementia, it's often misdiagnosed as Alzheimer's. And so we spent about 2 to 3 years just trying to find the right diagnosis for her.
And then the turning point, finding, why did you connect with Iona?
So I was working full time, had not started to have children yet, but recognized I had to move my mom in with me. She ended up, I want to say wandering, but it wasn't really wandering. She knew where she was, but she was in a state of confusion. And so one day, a woman that was helping me with her said, "I can't find your mother." I was here at work, and I said, "What do you mean you can't find my mother?" And she was missing for 10 hours or so. I was just getting ready to call the police and do a silver alert, and ended up doing one more turn around an old neighborhood and found her walking down the street. And it was then that I knew I needed more support. I was one of those caregivers who I now say, you have to ask for help, but I didn't ask for help. And I said, I can't do this, I can't risk her, and I need that extra support. The problem was in our community, we were in Prince George's County at the time, there wasn't a lot of support there that I could really fully rely on. We had Meals and Wheels and other things, but she really needed something to engage her throughout the day. I didn't just want her sitting at home. And so through my work here, I was brought on to Iona, and I said, wow, this is fantastic. The issue is that Iona is on Connecticut Avenue. It's in upper Northwest. In traffic, it's about 45 minutes to an hour. And we would be doing private pay because at the time my mom hadn't been able to spin down to receive Medicaid yet. So we didn't have those services. The private pay was fine. It was something that we were prepared to do. And so we tried Iona out and we loved it. My mom loved it. And I loved it as well. I felt that she was secure. I felt that she was cared for, and I felt that she was engaged. They knew how to engage her. The problem is my mom had frontotemporal dementia, and getting her out of the house in time to drive an hour to the facility at the same time as me trying to get to work, even her sitting in traffic for an hour caused extreme agitation. And so it was one of those things where I remember I was very teary-eyed, like we were trying to figure out how to make it work, but we couldn't make it work. You know, these were the days before it was okay to work from home. And so if this was today, I would be able to stay home and work until 10 o'clock and my mom get her up and going and bring her to the facility and then be able to leave work a little earlier to pick her up so that she's not sitting in traffic. And we did not have an Iona in our community at all.
Powerful example of the difference that this can make in families' lives. If having to continually do that commute every day and worry about the struggle and the impact on her. I think I mentioned to you on Sunday that Joon was very instrumental in helping me think about the design of this session and also obviously in the field trip because we had originally talked about going to the facility on Tinleytown, Connecticut Avenue, but Joon just schooled me. He said, you know, for journalists, and when you think about the tension or the newsworthiness of this topic, providing resources in communities that need them most would probably yield the best stories. So I want you to start by telling us more about you and your background and your work, and then tell us about this exciting grant that Iona got earlier this year.
Well, I was hoping that I could start in a different way. So I have a question for all of you. Since you're journalists and you ask us questions, I wanted to start off by asking you all a question. What does aging well mean for you?
That's a good question. Anybody want to take a stab at it?
Like, what are the first things that come to mind when you think about aging well?
Marquita, introduce yourself.
Thank you.
Oh.
I'm Marquita Brown. I'm a freelance writer and editor based in Herndon, formerly in PG County, though. And when I think about aging well, I think about, independence, especially in the context of this discussion.
Anybody else want to take a crack at it?
Hi, my name is Sarah Luderman from the 19th. I think when I think about aging well, one of the main things I think about is like autonomy and choice. I think there's a lot of, so I have a disability, and I think there's a lot of situations where I've been in care and there's very like small things that make a huge difference in terms of like feeling like a person, like things like getting to choose what you eat, when you get out of bed, when you get dressed. Like those things like are not things that we really think about, but I think that makes like a huge difference in terms of like people's quality of life and aging well.
Hi, I'm Amber Castillo, and I'm from a local news outlet called Epicenter NYC. And when I think of aging well, I think of support. I think of if you don't have that health, whether it's social, emotional, or otherwise, it's really hard to age well. So having that support in there if you don't have the physical health.
Those are good answers. Anybody else want to chime in? Or
Hi, Andy Richards, NJ Advanced Media. I think of good health, physical and cognitive, because if you have your brain and your body, then you can make your own decisions. And I have a mother, I just had to run out and make a call on her behalf, who is 87 and is physically fit but has dementia. And so what she rails against is what we've all been saying, is not sometimes being able to make all of her own decisions. So if you have your mind, you have a little bit more autonomy. So I think that's really important.
Yeah.
Those are great answers.
So we heard independence, choice, help, and health. Now these are things that I think all of us want, but in order for us to have independence, Liz, we skipped you. Did you want to?
It's kind of superficial. I care about being youthful.
Youthful, yeah.
That's all.
But there are things that we require to be youthful, and that's whether it's community engagement or activities or learning or education. These are all factors of us aging well. But in order for us to actually age well, basic needs have to be met. And that's the fundamental foundation of aging. All of us are aging. It's a difference. The matter is ultimately how we age that I think is key for many of us in the field of aging. So I want to share a little bit about the demographics of the district, the nation's capital, and why equity in aging is such an important issue for Iona Senior Services and certainly for AARP. Today, there are about 84,000 older adults living in the district, and this population will increase by 27% in the next 7 years. Among them, about 13% struggle with food insecurity, and another 12% are diagnosed with a form of dementia. And that number, 12% of 84,000, that's an undercount. It's an underestimate of the true reality of the health conditions here in the district. Rita mentioned that she's on Prince George's County. So I want to use this badge as kind of this is what DC would look like. It's like a diamond. And within this diamond, there are 8 different wards. And it's kind of like a city council district. But of course, DC is unique because it's not a state or it's not a county, and it's not considered a city. It's just the District of Columbia. But what's interesting about the district and the 8 wards is that there's health inequities and disparities from opposite ends of the city. So we just opened our Adult Day Health Center, which all of you will visit hopefully today, that's closer to Prince George's County. And so if this is the north side of DC, our headquarters would be over here on the left end, northwest, and then we open a center in southeast. The mortality rate between this corner versus the other, the distance is about 5 miles, but the mortality rate is 15 years. So imagine this. You live in a place called Ward 3 of DC, which is the northwest end of the district. Your chances of the amount of years you would outlive someone who's on the other side of the city increases by 15 years because of the access to the resources and the health support that you might be able to get. So we're in wards 3 and ward 8. And if you look at ward 8, the highest concentration of poverty exists in ward 8. The fastest growing older adult population is in ward 8. And currently the biggest population of older adults is in ward 3. But when you think about the access to services, they don't really exist as you go closer to Ward 8 and definitely in Ward 8. And so that's one of the reasons why we opened our center in Ward 8. But I also want to give a context to the economics of the city. The city's or the district's budget, annual budget is $1 billion. About $66 million go towards aging services. And $500,000 of the $66 million goes towards community-based organizations that support people living with dementia. So if you think about the numbers, there's about 12,000 people that are estimated to have a form of dementia in the district. And the district has about, among the 84,000, 74% of the aging population are living alone. So when you look at it from a care perspective and an equity perspective, the dollars are not going towards the services and the supports that people who are aging in this district really need. And so we applied for a federal grant, and the federal grant allows us to work on a 3-year project to support older adults who are in marginalized communities living with dementia. And so we're focusing on two populations. One is the LGBTQ population, and the second one is the intellectual and developmental disability community of older adults who are impacted by dementia. And so I think I'm so thankful that I get to be here and meet with journalists, because these stories are not being told. And government, I think society and government, we all have a responsibility to care for people who are aging around us, and it's not happening in the way people actually deserve, especially people who don't have a voice and who are invisible. So that's it.
I think now you can see why I was so influenced by Joon, because the way he articulated the contextual, broader picture of what was happening in the district, but then just drove home with numbers and using data, why it's important to focus on this issue. Rita, I want to come back to you. And again, hearing what the journalists responded about what it takes to age well, talk a little bit more about how you may have tried to juggle letting your mom feel like she was a person still with what you needed to do, which was to protect her and keep her safe.
No, and everyone here that spoke up did talk about that feeling of independence and having choice. And for me, it was really being able to at least have conversations with my mom and say, Mom, we have to do A or B. Which one is it, Or, one of the most difficult conversations that I've ever had to have was when we did have to make the decision to place her into a nursing home. And I think the hardest part of that decision was because we talked about choice, right? We didn't have choice. There wasn't choice for us. I had exhausted every choice possible. We had tried, because of her frontotemporal dementia, she had behaviors that I was not able to manage with a newborn and then a newborn and a 2-year-old. To keep everyone safe. And so we tried small community group homes. That was a discussion with her. Mom, I'm just not able to do this. And there was a lot of anger and a lot of hurt, because for her, she saw my choice between my children and her. And I saw the pain in her eyes, and she expressed it there. But she actually understood. I mean, she did understand. But even those group homes were not staffed well enough. As we know, this was a while ago. There continue to be direct care worker shortages, but also training issues. And so I wasn't able to keep her in community. And so one of the most difficult conversations I had, I remember, she was sitting on a bed, and I got down eye level. I was really on my knees and more of a kind of a begging for her to understand how we were now moving into this new space. And so we talked about how she was feeling, where she was living, and what some of the challenges were there. And I remember saying, Mommy, I can't do this anymore. I can't keep you safe. And that is the most important thing for me to do. What does that look like to you? What does that mean to you, right? So it's engaging her in that conversation, as difficult as it was, and we were able to talk about it. And at the end of the day, she said, I know. She said, but just don't leave me alone. Make sure you come and visit me. Make sure you're there for me. Make sure you bring my grandchildren. I know this is hard for you, but I understand. And so I think walking away from that conversation, I mean, we were all weeping. We were all in there crying. But we were able to walk away with her feeling somewhat empowered about it. I wasn't just saying, okay, tomorrow you're moving to a new place. We talked about, here's option A and here's option B. And to be really honest with you, option A, which is where we landed, was in what's called Sykesville, Maryland. And so in this area, that's 40 minutes from my home. But the nursing home that was right down the street from me, there's no way that I would ever place my mom there. I could get there, but the level of care would not have been what she needed. And so that, again, was another decision. So while it was choice, like we had choice between A and B, but is that really choice? Like, we should be able to be in our community, and I should be able to have her cared for in any number of settings, but we didn't have that choice. But at the same time, she knew that she was walking into a situation where she would be well cared for. And I think, as Sarah said, she could eat when she wanted to eat. And somebody wasn't waking her up at 7 o'clock to eat breakfast because that was the rule. And that she was able to get her greens and her other food that she really loved and were a part of who she was. So again, as you're aging and you talk about aging well, it's, while the choice isn't always optimal in our eyes, I think as long as that older adult is really able to see themselves being supported as much as possible, and to see that we are making the effort to allow them to live with dignity, that is really key. It's the unfortunate piece, and where the equity comes in, is that we don't have those choices.
Do I recall you saying that you're an only child, or do you have?
No, I have a younger sister.
So one of the things that I'd like you to give us some insight in, particularly from your role here at AARP, is in communities of color, where in some ways the family caregiving thing might be a little bit more ingrained in the culture, et cetera. But when it comes to having to make these kinds of choices, money comes into play. You say that you refused to allow your mother to be in that setting because you knew she wouldn't get the care. But often in low-income communities, you don't have that choice. Talk a little bit more about the need to raise awareness about the importance of the equity issue.
Absolutely, and I think one big piece on the equity is that, especially when we're talking about communities of color, it's important to know that I think we've lost our status, but Prince George's County used to be known as the richest Black county in the country. The richest Black county in the country, so it wasn't even a matter of low income, right? We were middle income. And we still didn't have access to services and supports. I think within the Black community, as you said, I actually ended up being a black sheep, right? Because although I tried everything to help support my mom, at the end of the day, the best care for her was being in a facility, and that was a big no-no. It was, how did you do that? Why did you do that? There was nothing else that you could do. And I think what we see, and I'm just coming off of a friend who decided to keep her grandmother at home for this reason, a lot of pressure, a lot of, you know what, I've got this. I don't need the support. This is what we do. We take care of our family. We don't place them anywhere. Well, her grandmother now has bed sores because she didn't know how to properly turn her. She didn't know how to properly support her in the home. And so now we're dealing with this situation where I'm helping her now find placement, right? But now we're trying to find placement and her grandmother is not in a good situation. And so what I try to say quite often is that we have to be very real with our stories and with our situations, but we also, and this is where equity comes in, where is the access to care, right? When we look in Black communities, when we look in Latino communities, and this is across the socioeconomic spectrum, where are the good healthcare centers, right? Where are the adult day programs? Where are the Ionas? Ionas should be everywhere. If I had all the money in the world, I'd give it all to you.
Play
They should be
Powerball,
right, except Powerball. I will do that. But that is what we're missing, is that access to care is not there. So people like my family have to make the choice that I can't care for someone in home because those resources aren't there.
Joon, I'm going to let you lead us into the Q&A with the journalists by inserting the role of policy in this discussion, because clearly I'm sure you had to have some really intensive conversations with policymakers and whoever to get this grant from HHS. But what we've learned over the past day or so is that it's difficult to get that kind of movement at the federal level. And certainly states have to try to do what they're going to do. But talk about how you really move hearts and minds in this issue when you're talking at that level. It's
hard. It's very hard. But I'll give you an example. So I was at a conference earlier this year. It's called the American Society on Aging Conference. And there was a panel, and the panel's topic was advocacy for dementia policy throughout all the states. It was an 8:30 panel. Maybe there were probably 10 people in the room. But about 9 of the folks that were there directly in multiple states work with the dementia population in their states. And there was a legislator there. And when the panel concluded and the Q&A section started happening, the 9 folks started talking about how difficult it was to move the hearts of legislators to drive policy to support the aging population that are living with dementia. And that population, the dementia population throughout the world, will double in the next 20 years. But the infrastructure isn't there. And so these 9 folks are talking about the need for legislators to get on board. And what are the policy strategies that we have to employ to get them on board so that resources are flowing through the states from the federal level? And the legislator from the back of the room raised her hand and she said, I work in this state, but you should know that where we just passed the bill, to have a dementia navigator in the state. But that's one person that's there to support the needs of thousands of people. And so there's a disconnect between the people who are living lives, aging in community, and then the lawmakers who are responsible for drafting the policies that impact the lives of every one of us here in this room. But it's the stories. It's Rita's story, her relationship with her mom, the difficult choices that she had to make. And that's what I think the difference is. I'll share a story with you about when I first got to the Congress Heights office. Our headquarters is on the other side of the city, but then I moved my office down to Congress Heights, and there are these glass windows, and around noon, all the participants in the center do a loop-de-loop. And what that is that the center was designed in a way where people can, it's almost like a track, where people can walk throughout the entire center and have a full circle. And there was this participant who would pass by my office and start signing her name, like American Sign Language, to me. And we started connecting, and she started teaching me how to sign my own name. And when I would see her, when I would meet with her, she would be in the art studio. When she was in the art studio, she would light up. And it was one of the most beautiful things that you could see because she came alive. It was something that really spoke to her. And so there's a theater group here in DC called Mosaic. And so I reached out to them and I said, we partner with the museums here in DC so that our participants can have cultural and art and music opportunities. And so we have these relationships throughout the district with art institutes. So the Mosaic Theater came to our office, our site, they did a tour, and I said, there's someone I want you to meet, and I want you to share with her about our partnership. And so they met with her, and she walked away to her next activity, and these are the directors of the theater, and they look at me and they say, we know who she is. And I said, how do you know her? And they said, she was a person responsible for launching the careers of everybody in their generation in the field of theater and playwriting. And they had asked among themselves, where did this person go? It's almost as if she disappeared, and they had always wondered where she had gone. And I later went and Googled her, and she was this incredible figure. She was a professor of theater in many of the major universities here, and had one of the highest levels of prizes for just her work. And it's these stories that we get to tell with legislators where they start thinking, oh, that's like my mom, or that's my aunt. And I think when we share the numbers with the legislators, they're surprised by the numbers, but then when they actually meet the people who are experiencing the challenges of caring for a loved one or aging well in the district, that's when they their hearts begin to turn. And then slowly we get to see them be more involved with supporting organizations and supporting people who are aging with different types of abilities.
Let's open it up for questions right now. Does anyone have questions for?
I hope you didn't already tell us what this is, but I wanted you to define frontal, what is it?
Frontotemporal dementia?
Yes.
So frontotemporal dementia, it can be sporadic, which is what my mother had. So basically it's when the frontal temporal portion of your brain is damaged. For some, it's a genetic disease. So there's full families that have or will eventually get frontotemporal dementia. For my mother, it was a brain injury. For others, it may be some other health concern that causes it. There are a couple of different forms of it. So one that may be familiar to many of you in this room is what Bruce Willis has. He has frontotemporal dementia, and he has, it's called PPA, where he's losing his ability to speak. My mother had the behavioral variant of frontotemporal dementia, and that causes different types of behaviors. So apathy. When my children were born, My mom was in, we brought her in, I was in the room, we brought her in, she was there, she was holding her grandchild, but you would never know that this was her firstborn grandchild, right? She was just apathetic. She couldn't emote. There are also other behaviors. There can be swearing. I say this, we can laugh about it now, but my children learned their first curse words from their grandmother. I don't know how many people can say that, and we chuckle about it because it was who she was, right? And so FTD is something that, again, it's a rare disease. There are less than 300,000 individuals in this country that live with it. But it is very, very different, different from Alzheimer's and other dementias.
Thank you.
Rita, my mom also had FTD, so I feel you, everything you're talking about. I'm curious, but this is a question for both of you. I think one of the challenges of something with FTD, and when we think about like these services, when you have behaviors, that can be, I mean, you can be evicted, I know my mom was asked to leave a senior day center because she would like spit, which was one of her behaviors. And Joon, I'm curious, do you deal with that, and how do you deal with that? And I feel like because we're so ill prepared for what's coming, and there's so many different types, we always think about Alzheimer's only, but we don't think about even with Alzheimer's, there can be behaviors and different challenges. How do we ensure that we have places where people can properly care for individuals and support them? Like, there's so many things that come up in long-term care, in day centers, and it's like as soon as there's an issue, you're asked to leave. So I just wanted to get your thoughts on that. Like, how did you create your space to be a space where I could have placed my mom, which was so hard?
Yeah, it's about training, proper dementia training for staff. And one thing that Rita mentioned was the workforce shortage. And one of the things that we're experiencing today, or this year, was that because of the shortage and the need to staff, what we realized was that we had a difficult time finding folks who were trained, who received the dementia training. And so we onboarded someone, and we provided the training, but this is the type of training that you need on an ongoing basis for extended periods of time. And also you have to relearn over and over again. And you have to, retrain yourself and relearn so that when you are working with participants, it becomes second nature or muscle memory. But it starts with training. And one of the things, because of that, what we learned through the workforce shortage was that even if we try to provide the training as people come in, the experiences that they have, even for staff coming in, could be difficult for them too. And so one of the things we learned was, how do we support staff in a way where we're caring for their mental health and well-being, and how do we support them with the training that they need, but also making sure that the staff is receiving training on a regular basis to meet with the participants. And so, yeah.
Just a follow-up, is there a standard like dementia training that's like nationwide, or is it specific that it's your own curriculum, or the mental health training that you give to staff as well? Like, is it universal?
There is a standard. There's standard training. There's also standard ways of measuring as well. But you can imagine, because of the day-to-day work that staff have to, that are a part of, it's so important for us to build out as often as we possibly can the trainings to help people remember over and over again. These are standards, but standards need to evolve constantly. And as Rita mentioned, there isn't just one type of dementia. There are so many different forms and types of dementia, and also its behaviors come with that too. But it's also educating and training staff that, this is the population we're here to serve, and creating space so that they can learn, but also ask questions too.
Can I add to that just a couple of points to build off of what Joon is saying? It really is also about ensuring that families understand, right? It took us 3 years to get an FTD diagnosis, as you probably have a similar story. And in the meantime, we're trying to figure out how to manage this at home, right? How to take care of her at home. So it's educating the family so that when I do go to a nursing home, I can say, no, memory care isn't really going to do anything for my mom, right? Because this is what is going to happen, and having access to those services. The other thing I will say, there's, some hope on the horizon. I think about CMS and the guide model that was just kind of put out in terms of helping. It's a pilot program that is coming out of CMMI to really help families of those caring for individuals with dementia to receive a care navigator to help them on the journey. It's limited, right? It's an 8-year pilot. It's limited, but it's movement that we hadn't seen before. The other thing is, I think it's by the end of this year, CMS is also saying that we are going to now pay medical providers to train family caregivers how to provide different types of care. How to get someone up from a chair, how to help someone toilet, how to help someone with behavioral management. So we are seeing, at a slower pace, but much faster than we've seen in many years, that even at a national level, and a lot of this comes out of the RAISE Act that was passed that focuses in on how to support caregivers, that we are seeing this movement as well.
Rita, I wanted to ask you about something that I've been saying over and over the past few days about the perception of the workforce in long-term care. It's almost, in my opinion, almost as if people perceive this inexhaustible supply of Black and brown women, primarily, who are going to take care of this issue. And if they fall out or have an injury or whatever, there's 12 more behind them to take their place. What are your thoughts about how providing an opportunity for professional advancement, for training for the workforce could transform communities, could really support families?
No, it's a really good point, and I think workforce is an issue that we talk about a lot here at AARP and is clearly on the tip of everyone's tongue as I think COVID really kind of woke people up to the crises that has been brewing in workforce for quite some time. Black and brown and immigrant women are overrepresented in the direct care workforce, and they are undercompensated in the direct care workforce. And so it really is critical. There needs to be a pipeline. I'm channeling Dr. Susan Reinhard, who I know you all met with, I guess, on Sunday. And she and her team are leading a lot of efforts around that workforce, and particularly in the health equity space. So ensuring, to your point, Rachel, that individuals, there's a pipeline. So you may start as a certified nurse assistant, but that you're able to move into LPN, a licensed practice nurse. And then you have a pipeline to move up into an RN position. And that's a critical pipeline that needs to happen. However, we have to make sure that that direct care worker, that individual, you're not going to find an RN in the home doing the duties that family caregivers really need. And so what are the creative ways and solutions to build that direct care workforce, but then once you have built that, continue that pipeline all the way through? And there are innovative programs. We are seeing increasingly across the country programs in high schools that are looking at how to create vocational programs around building a workforce. But it's not going to work as long, you're not going to be able to build a strong, solid workforce until the compensation comes, but also the training. We hear from direct care workers all the time the injuries are prolific because they're not being trained properly. They don't understand, to our point, they may be trained how to care for someone with Alzheimer's, but I think back to, and I love, all of them were like family to us, to the direct care workers who would say, I tried to give your mom the medicine and the chocolate pudding. As you might imagine, the direct care worker now had chocolate pudding all over them, right? But to be able to find someone that could laugh it off and keep moving and not say, this is it, I'm out. You know, and also recognizing that this direct care workforce, they also get a lot of racism, right? They experience a lot of racism from the individuals whom they're taking care of. And so again, recognizing that we need to provide support in so many different ways, because as that family caregiver, if there's not a direct care workforce there, guess who's taking care, right? Guess where the responsibility lies? And then I'm supposed to work at the same time, right? And I'm supposed to care for my children at the same time. It becomes an impossible circle.
We are oh, do we have one more question? Okay.
Hi, it's Nina Keck with Vermont Public. I was curious, Joon, my community in Vermont, I live in a rural part of the state. We lost our one adult daycare respite center during the pandemic, and there's no sign that it will reopen, so families have no options during the day. You said you opened your second site in the district in an underserved area. Could you still do that now?
What do you mean?
Well, financially, just
yeah.
Can you make the numbers, like, I'm wondering, will we ever get, in my
Right.
rural community, it's also underserved for different reasons, workforce,
Right.
everything else.
The numbers don't work, and that's the thing. So what you just pointed out was it's a national trend that during the pandemic, more than 40% of the adult day health centers throughout the country closed because it's a model that is difficult and is unfunded. So the way in which we're operating our model in Congress Heights is we need philanthropy to kick in and to help meet the deficit that we run on an annual basis. Because we have medical staff, we have social workers on staff, the space and the art therapists, and just the sheer amount of work that goes into running our center, we do run a deficit where we have incredible supporters and donors come in to support the center. But we have a plan in which we want to leverage Medicaid reimbursements as much as we can to offset the costs. But it's happening throughout the country because the support that's needed in a lot of our communities is not there. So it's a difficult thing.
We are going to have to wind down. Did you have one urgent question or?
No.
Oh.
I do have a question, but I want to ask later.
Okay, let's ask it later. What I like to ask each of our guests to do is send the journalists back to the newsroom with at least one suggestion for a story that they should maybe try to do right away. So Rita, let's start with you.
I would love to see a story that talks about the intersectionality of caregivers of older adults. I think so often we silo individuals by race, by economics, by income, by sexual orientation and gender identity. To be able to tell a story of someone that is experiencing all of these things and the equity issues come at their intersections. To be able to tell a story about someone, their whole self, and how they are challenged, whether it's an older adult or the caregiver or the family, right? Family of choice, friends, family, to really be able to get at these issues. Because if we keep trying to solve them in one-offs, we're just putting Band-Aids on. But to have systemic solutions, we need to tell the stories at their intersections.
Joon?
That's so good. So there's another trend happening in the country where more older adults are becoming homeless. Here in the district, 40% of the unhoused population are older adults. A story or a report that's not coming out is that certainly the intersection between folks who have dementia and that population becoming unhoused because of their cognitive condition. There isn't enough research. There's a research done by the VA on the intersection with dementia and homelessness in the veterans community, but there isn't one that's coming out in the broader general population, and it's going to continue, and it's going to get harder because of the economy, the rise of cost of living and lack of housing opportunities for older adults. And then there's a lack of services that older adults need to age well in their community. So that's a great story, I think.
It is, and this has been a great conversation filled with context that we need. So I'd like to take this opportunity to thank Rita Choula and Joon Bang. Let's show them our appreciation.